Our last video in this week's chapter on joints is going to be focusing on a few specific joints and then some disorders that we see with those joints. So the first one is going to be our jaw joint, and so where the temporal bone meets the mandible, and there's a few different joints going on, condylar, hinge, and plane joints all at that one spot. And this talks about, for each of these joints that we're going to take a look at, these slides are very specific. They talk about chambers and bursa and ligaments, and you don't need to memorize any of that, even though it's all in bold print. You don't need to know that. Just we're going to talk about some of the difficulties at these specific joints. So that's what I want you to focus on. So a deep yawn or a strenuous depression can dislocate the jaw. The condyles pop out of the fossa and slip forward. This can be relocated by pressing down on molar teeth while pushing the jaw backwards. So let's take a look at this joint close up. And there's your mandible. And so there can be a TMJ syndrome that could affect as many as 75 million Americans. Some signs and symptoms, some facial pain, clicking sounds in the jaw, limitation of jaw movement, headaches, pain, and this can be caused from a combination of psychological tension and a misalignment of the teeth. So they have treatments including psychological management, physical therapy, anti-inflammatory medicine, and then corrective dental work for aligning the teeth properly. So that's all affecting quite a few Americans, just that one joint. Okay, we're going to look at the shoulder joint because it is the most freely movable joint in the body, but it also can have some problems. It is one of the most complicated, and so this shows all of the tendons listed, the ligaments, and how many bursa there are, 4 bursa in the shoulder, and so we'll take a look at the scapula and kind of how everything fits together, all of these different stabilizers of the shoulder joint. Like I said, I don't need you to memorize all of these, just realize that being the most freely movable joint in the body has quite a few ligaments and tendons and stabilizers. So this shows the rotator cuff muscles. And so shoulder dislocation is, don't know about common, but it definitely happens. It can be very painful and sometimes cause permanent damage. The most common shoulder dislocation is from the downward displacement of the humerus. So the rotator cuff protects the joint in all directions except for inferiorly. So that's why that is the most common reason for the dislocation of the shoulder. And they usually occur when the arm is abducted and then receives a blow from above. And children are most prone to this type of dislocation. Okay, I'm going to actually go past the elbow and past the hip. I have a feeling that the one that you're going to be studying in the lab is the knee. So we're going to start about that. The knee is the largest and most complex synovial joint. It's primarily a hinge joint, but it is capable of slightly rotating and also laterally gliding when the knee is flexed. So take a look at the tendons and the muscles and the cartilage. We talked about the meniscus that we see in this knee joint, and so there's a picture of the meniscus. We have one coming from the left and the right. And so there's lots going on here. This has 13 bursa, which we're going to see on the next slide, I believe. You do have the ability to lock the knees, which is an important aspect of our human bipedalism. That means walking on 2 legs. When the knee is extended to the fullest degree, that we are allowed to lock our knees by the ACL. And then we unlock the knee with our muscle that rotates the femur laterally to untwist those ligaments. So 13 bursa. You don't need to memorize them all. That's kind of a lot going on. But it just gives you an idea of how complicated this knee joint is. And again, I have a feeling that this is what you're going to be focusing on in the lab. There's the meniscus again. So we see plenty of knee injuries is pretty vulnerable to rotational and horizontal stress. Most injuries are from the meniscus and the ACL. They heal slowly. And this talks about how we can see the inside of the joint through a small incision with an arthroscope, which helps with our ACL repair. We can recover more quickly when it's repaired that way. And then we're going to go through the ankle, past the foot, and talk for just a second about arthritis. Arthritis is a broad term for pain and inflammation of a joint. It is the most common crippling disease in the United States. Osteoarthritis is the most common form. It's just basically wear and tear, years of wear on our joints. The articular cartilage softens and degenerates. And this is where we see these crackling sounds. I think I might be in trouble because I already hear my crackling sounds on my knees. And I'm not that old, so we can develop bone spurs when the exposed bone tissue, or bone spurs develop on the exposed bone tissue, which cause pain. So you may have heard of RA, or rheumatoid arthritis. This is when there is an autoimmune attack against the joint tissues. So our antibodies that are misguided, called the rheumatoid factor, they attack the synovial membrane, and the enzymes degrade the articular cartilage, and the joint begins to ossify or turn to bone. So that's why individuals with rheumatoid arthritis look as if they cannot bend their joints. That's because that their joints have turned to bone and eventually are become an immobile joint. So sometimes the disease joint, or if the joint has ossified, can be replaced with an artificial device called a prosthesis. This is possible for joints. There's an example of an x-ray of an individual with rheumatoid arthritis, and this is what some of these joint prostheses would look like. So there's your knee, which is pretty crazy if you think about it. But if you need to have that joint replaced, this is an option. So I realize I kind of skipped through some of those joints. Again, it's just to show you some of the more complicated joints and how many tendons and ligaments there are. Don't feel like you have to memorize any of that. You don't. Just feel comfortable with some of the disorders and problems that we see with the ones that I discussed.